We are a Medicare fraud prevention program. We've been located in the Attorney General's office since 1999. Initially, our program was called SNAG, which stood for Senior Nevada Advocates on Guard, which was a little confusing because we've always been a Medicare fraud prevention program. But pretty much what we do is try to get information out to seniors, their caregivers, et cetera, on how to recognize healthcare fraud, Medicare fraud, who to report it to, how to report it, and just how to recognize it. Periodically, we do presentations on our program to different groups, whether it be senior housing groups, senior centers. We do a lot of health fairs, both, in Vegas and obviously here in Pahrump. We were in Beatty yesterday, and just all throughout the state. And even though we are located here in Vegas, pretty much we are tasked with getting the message out to the entire state. We are a federally funded program, but like I said, we're in the AG's office, so we have to follow the state rules too. Makes it a little interesting sometimes. Also, part of our program is recruiting volunteers, and I actually was doing a volunteer training at the library here a couple months ago.
You will be at the upcoming health fair that's going to be at the Pahrump Nugget as well.
Yes, ma'am, I will. Every senior that's on Medicare, or should I say just regular Medicare, they get what is called the Medicare summary notice, and what we tell them is to, review what they, when they go to the doctor, write down what they do at the doctor's office. We do have a booklet, a personal health care journal that we tell people, when you go to the doctor, write down what they do. Then when you get your statements, just kind of compare it. Make sure what they're doing at the appointment is what they're charging for. If they are on a Medicare Advantage plan, they get a separate document. It's called the Explanation of Benefits form, which basically has some of the same information, but just to keep track, to make sure that they're not being double charged for something, or being charged for something that wasn't done at all, being charged for something different than what was done. That's pretty much what we tell people to look for.
And when a person thinks that they have had some fraud go on, what do they do?
Their best bet is to call us. The Administration on Aging brochure suggests that they contact their provider or their plan first. I always tell people, because I know a lot of people are really uncomfortable about calling a provider, calling a plan. If you're hesitant about doing it, or even if you're just not sure if it's wrong, give us a call, because I'd rather look at 50 different things and have 48 of them be there's nothing wrong, they're just a little confused, rather than them not being confused and not call us. A lot of the calls that I get, that at least that are pertained to our program, they're looking at their Medicare summary notice, and they're looking at that very first column as to what was charged. And unfortunately, or fortunately, that amount is never the amount that Medicare is going to pay. There's always a Medicare allowable, and then ultimately what the patient will be billed. I call it the stop and wave. The walk-by waving is actually what I like to call it. And from my understanding, the way that the Medicare rules are, that as long as someone, a doctor, physician's assistant, or whoever, as long as they are reviewing the patient's chart, they can charge Medicare for that. I mean, unfortunately, the only people that can change that are the people at Medicare.
How can a consumer stop a doctor that they don't even know is going to ultimately charge them from coming in the room and looking at their chart?
To tell you the truth, I don't think that there's anything that a patient can do other than to just say, look, I would rather you not, unless I know you. But I don't know really how far that would be able to go with just a patient just requesting it. Exactly. Contact my office. We do have a toll-free number. It's 888-838-7305.